And obviously chronic inflammation being in this diagram as an end result of senescence. So talk to me about inflammation and its role in kidney disease and everything else.
The factors that work during the inflammation persist and stay active in the body.
Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am naturopathic practitioner Fiona Chin, co-founder of the Kidney Coach, Kidney Disease Solution, and Kyogenesis, which are our products. And I am joined today again by a very distinguished doctor, and that is Dr. Alex Grinberg. Alex, thank you again for joining us. So Dr. Grinberg is a very distinguished medical professional. He started his medical training when he was 16. So I call him a bit of a savant back in Moscow. And he completed 3 years of his PhD program in clinical immunology. He's got over 3 decades of experience in medicine. And I think what I really appreciate about Dr. Grinberg's knowledge is that he has got all of this amazing knowledge when it comes to the latest technologies coming out, biotech, and their advances in medicine, and then how to stack that along with things like longevity, peptide medicine, to really add to what Western medicine can offer us, and then really take that to the next level by really staying on the cutting edge. So he works in clinical practice, he works with patients. I'm sending him my very complicated cancer patients all the time because he's got such a good amount of knowledge around that, and all the, like I say, the latest technology that's coming out. So Dr. Grinberg, thank you again for joining us. I always appreciate your time, knowledge, and expertise. Is there anything else you wanted to add to that? I know you are really on the cutting edge. A big one that I think I'm yet to come across a patient with a chronic disease that doesn't have some sort of degree of this, and that is chronic inflammation. And obviously chronic inflammation being in this diagram as an end result of senescence. So talk to me about chronic inflammation and its role in chronic disease, because it was maybe 10 years ago where everyone was like, well, all chronic disease is just in an inflammatory based disease. Obviously, we know it's a lot more than that. It's related to all of these things in senescence, but inflammation's been very well accepted and studied as part of the conglomerate of diseases of aging and all those sort of things. So talk to me about inflammation and its role in kidney disease and everything else.
So first, unfortunately, inflammation was demonized as a bad process, while most of the time it saves our lives. So it's a basic mechanism how our body protects us from foreign intruders. And so this process that combines very coordinated response from immune system, from vascular, neurovascular response, and even certain endocrine response. This process, while being very helpful and protective against say bacteria or viral or fungal or any other invaders that come from outside. At the same time, when the factors that work during the inflammation persist and stay active in the body, they become very damaging for the body, and not only locally but across all organs, tissues, and cells. And so for convenience of the explanation, when inflammation happens, there are a lot of signaling between the cells. Cells need to communicate fast and actively, and for this they use molecules, cytokines, among many other. But cytokines are very strong, very biologically active molecules. Probably many people heard about them during COVID pandemic, when they found out that the cytokine storm was responsible for rapid deterioration and overwhelming pneumonia and even death of people. That's why inflammatory cytokines are so active that they can affect actually any system and any cell in the body. They create many secondary reactions and very remote from them cells. For example, inflammation in the knee can create production of cytokines that eventually will make blood-brain barrier more penetrable for things that are not supposed to go there, including microbial organisms and or some other inflammatory molecules, other cytokines that create inflammation inside the central nervous system that called neuroinflammaging. And in this same way, they can affect glucose, insulin sensitivity and glucose tolerance, because for acute inflammation, the body needs one thing, but when these inflammatory signaling molecules start pretending that there is still state of the war, they deprive all other cells and organs from vitally necessary substances, and they still in war, and they consume everything, and they block all other cells from all normal process to create condition of agitation and abnormal functioning. It's false alarm.
Yeah.
It's very taxing on mitochondria. Actually, all these inflammation-related cytokines, they affect receptors on the surface of the cells. Some information in forms of peptides, in this case, unnecessary peptides, gets inside the cells organelles, affect how mitochondria function, energy production, lipid peroxidation. In the level of physiological response, it leads to loss of metabolic flexibility. And I want to mention and bring this term because in simple terms, when you're hungry and instead of wanting to eat chicken breast and broccoli, you crave for tiramisu or chocolate cake, it means your cells want easy fuel. And but if you crave, let's say, for some healthy food, for some healthy fats, it means your cells have time and energy enough to digest more healthier and frequently more difficult to metabolize product. And when the cells, not only stem cells, but many other cells exhausted and in the state of emergency claimed by inflammatory cytokines, they just need first and fast fuel, just carbohydrate and junk food. And then if people follow this craving, they get more junk, more endotoxins, they block their normal signaling even more, and it sustains inflammatory cascades. And then there are so many unwanted reactions affecting this mTOR receptor, and that is a target for longevity-related research. But so many of them get activated, cascades leading to apoptosis, cascades leading to changes in proteostasis, and also eventually cascades leading to normal maintaining of telomere lengths and restoring their length. So everything gets affected. And for kidney condition, there is a clear parallel. People who have secondary kidney problems, secondary to diabetes, they know well, they violate their diet, they see changes in their creatinine and drop in EGFR. Or they know, and they tell me that they know that they just had this little sin eating the cake or drinking a little bit on a birthday or some party. Yeah, but that's simple example how clinically you see manifestation of this deep and scientifically described processes.
Thank you for your expertise. If anyone wants to contact Dr. Grimberg and work with him one-on-one, whether it be kidney disease, especially integrating peptide medicine into your regime. I know I've used him personally for that. I'll put Dr. Grimberg's details below. He works out of San Francisco and is available to do telehealth and Skype consults with people all around the country. So, and as well in different countries, because he's working with some of my cancer patients. So again, Dr. Grimberg, thank you so much for your knowledge and expertise. It is always a privilege and an honor to have someone as esteemed as you on our channel sharing your wealth of information. If you want to know more about what we do, head to www.kidneycoach.com. You'll find us on Instagram and Facebook under the same name. Remember to hit subscribe and like. That way you will be notified anytime we put up new videos. And if there's any topic that you want Dr. Grimberg to talk about, or if you have any questions about this podcast, please put them in the notes below and we will be sure to answer them. Thanks again for being part of our community. Dr. Grimberg, thank you again for your time, and I look forward to seeing you all next time. Bye.